On this episode of Quick Hits, we're joined by Josh Wilda, Chief Information Digital Officer at University of Iowa Healthcare. With more than 25 years of experience across healthcare and IT, Josh has built a career at the intersection of technology, strategy, and patient care. Starting with his early days at Epic and evolving into executive leadership roles across major health systems, including Michigan Medicine. Now at Iowa, he's leading digital transformation efforts that extend far beyond traditional IT, focusing on how technology can strengthen the connection between patients and providers while supporting care delivery across the state. In this conversation, Josh shares his unique journey into healthcare IT, how the role of the CIDO is evolving from operations to strategic enablement, and why modern health systems must think differently about data, AI, and digital experience to truly move the industry forward. Welcome back to another episode of Quick Hits. I am joined today by Josh Wilda, the Chief Information Digital Officer at University of Iowa Health. Josh, how are you doing today?
Yeah, Tyler, thanks. Long time coming from interactions you and I have had. Things are going great. University of Iowa, it's being March Madness right now. We've got exciting things happening with our men's basketball team, but I know today's not just about the university sports. It's more about healthcare and where we're going. So glad to be here.
Always glad to see when the Hawkeyes are doing well. So I know that's a great way too to get acclimated to a new community. And I know this is a new role for you. I know you've been in the Big Ten. So maybe you're having to shed some Wolverine skin, if you will. But yeah, if you don't mind, just kind of giving us your story, your background. Like you said, I always love running into you at conferences, and glad we finally got to nail down the time to formalize our conversations. But would love to hear about your journey and then shed some light on what you're doing right now.
Yeah, I kind of had a different trajectory when it comes to healthcare and IT. I'm one of those as an only child talking to my parents. It was always, you're going to be a doctor, you should be a lawyer. And I went into healthcare. And as I was going through my undergrad, I realized there's much more to being within the healthcare ecosystem than just being a provider at the bedside. While very important, there's a larger ecosystem. And I really gravitated more towards leadership and how do you enable those folks that are at that bedside. So I got a really good chance out of school to work for Epic and learn more of that ecosystem in partnership, which really then evolved into my focus on how does technology really bridge that gap and allow to increase the intimacy between our patients and providers, because that's what we're all about. So I've spent the past 25 years, most of it within the Michigan market, very winding career that ended up there at the University of Michigan Medicine, which I loved my time there at the Big Ten. I was part of their regional network as they were building the community health arm. But as I was looking at my career and impact, the power and the impact that University of Iowa Healthcare has for the state, what it does for our rural communities. I'm a Midwesterner at heart, even though Michigan is in the Midwest. So I had the opportunity to come here as the Chief Information Digital Officer. My predecessor, Lee Carmen, was here for 30 years and built an amazing program. And I have the honor of taking that legacy and increasing the abilities of what we can do in the state from a digital transformation perspective when it comes to healthcare.
Fantastic. So it's a 30-year role. So you're 1 year in, or you're not even 1 year in.
Not even 1 year in, 7 months still.
7 months. Not even to the 130th mark. Can you talk a little bit about how leadership has evolved? Obviously, would love to ask you a little bit more about the Epic work, the early days, because I'm sure there's some amazing stories. But yeah, you've been in the industry for a long time. How has leadership evolved, and how in your new role are you basically setting the course for the next stage of evolution?
Yeah, great question. I think it speaks to what I was saying earlier. I had a different trajectory where you might see more folks in our role come from the traditional IT space, bare metal, technical, which is fantastic to have that experience. But now it's more encompassing. And I see as his leadership has grown, specifically in healthcare and IT, it's more about understanding the relationships and business enablers. With the role of a chief information digital officer, and our titles have changed over the years. From CIO, you always see these booms of these other roles taking place, and then seeing the synergies where they merge. And I think as you see the new CIDO role, where leadership has been really focused is less on operations, although still the basis of what we do. It is more about strategic enablement. It is more about how do we, as a leadership team, understand healthcare enough to be ahead of the business. So when those needs arise, as volatile as healthcare can be, whether it be reimbursement platforms, whether it be new needs of our constituents and our patients, really having that true understanding and being able to deliver, and not just take orders of, hey, we want to do this, go give me more information enterprise wide. But now it's more of being sought out for what do you think? I think the other big thing, and we're seeing it in the industry happen as well, is as I see my role being a strong partner these days with even operations. I see these days that IT is more and more involved in early conversations, again, not from an IT solution, but we
Right.
serve the whole gamut of the healthcare system. And so we can be a great connector of other services, especially as an organization like University of Iowa is larger. We've got a lot of services with a tripartite mission with research, education, and healthcare, and we're able to connect dots. So I also see us as leaders being more advisors these days of even interworkings of what's going on in a health system, which really positions us for great leadership opportunities in the future.
Yeah, it's fascinating. And a lot of what I'm hearing, and I could be misinterpreting it, is in a way, it's like you're a conduit between the technology that's out there and then what you see within within your system, but you're also connecting the different parts of your system, maybe through the guise of technology or through
Yeah,
technology. And
we're
yeah, so
yeah.
yeah, I don't know if you want to elaborate on some of those
You're right.
examples where you
We're
connect
we're a
dots.
convener of services these days,
Yeah,
right? We do have a hyper focus. If RevCycle were to come in and say, "Hey, we need to make these changes," it is our job to really help guide what upstream and downstream impact could they be on our infrastructure, on where our strategies are going. So I see a lot of even my senior leadership team sitting at tables to hear and listen to know who to help connect within our organizations or vendors to be strategic enablers. Again, more of a difference than what I've seen, and even it's evolved over time where these areas or these groups maybe struggled in that arena, not understanding the total impact or understanding the total ecosystem. And we're helping bridge that gap. And I'm seeing that even not just from the senior leadership teams within our IT groups, but even in our analysts, the way that they think, or even in our pure technologists, instead of just thinking about racking and stacking servers, really understanding the why and helping
sure.
others connect that why to understand what an enterprise grade ecosystem would look like.
And so as you do this work, obviously the best way that I guess we've found as a services firm is you build trust through performing excellent work, and that then it has a compounding effect. So I guess maybe you could talk a little bit, more about how your teams build trust across operational, clinical, and also like how you all drive towards a long-term vision. And maybe if you have like an example or two, I know you're early at Iowa, but at Michigan, where you're able to cobble these kind of different stakeholders together and push everyone in a direction that's beneficial for the whole organization through IT.
Yeah, it's funny you should say that, Tyler, because I was just talking to our Chief Health Information Officer, Dr. James Blum, and we were talking about as I'm coming in, what are we going to enhance? What are we going to do as an organization? What do we need to do? And a couple of different things. They have really good pathways and partnerships with being a consultancy like Health Data Movers and others, where first it's about services, us understanding the services that the organization needs from us? And are we organized and designed to help strategize around those services as well as being out front? So we were even talking about, what do we call our constituencies?
Right.
End users, customers. What's that real feeling? And we were even talking today, clients. There
Right.
are clients. We're there to serve. So first off, having a good understanding of the services, so then we can communicate them to the organization, so we can be way up front in those strategy conversations. There is still some stigma out there that all we do are computers or server or network. And so getting leaders to think way out front of bringing us to the table early, not so we can provide a solution way up front, so we can help them craft even problem statements or even opportunities more so. So just like an early engagement with a client, understanding, listening, getting feedback, as opposed to, okay, we'll come in and tell you what tools you can use and what tools you can't. Listening and really getting that customer voice and them seeing the transparent strategy of where we're going really then helps build an ecosystem of partnership versus we need, you answer, versus what do we need as a university, and then what do we break down in the healthcare system? And then it is about delivery from that standpoint. How can we then be an organization that's nimble, that connects all of those dots, that doesn't create a lot of process for process sake, that it's meaningful process to get us to quicker resolution on issues or quicker ROI on technology innovations. And I think those three steps of service-oriented way up front with a lot of explanation and a lot of partnership of bringing us in early, the voice of the customer, building strategies together, that it's not about technology, it is about healthcare, and lead with our needs before we lead with tech. And then in the end, us devising a transparent roadmap with executables that are shown, that have the voice of the customer in them, that are able to pivot when needed, but also stay the course when tried and true. You put that ecosystem together, I think that's nirvana. There's always tensions in between when a services organization like us, other services, support services, there's always tensions. Priorities are all over the place. At a large ecosystem for us, it's also about how do we connect the dots on the why? Instead of, being part of the university, our focus is research, education, and healthcare. We have a tripartite mission. If we treat those as separate missions, man, work can get overwhelming. But if we can connect those dots on those three separate missions to then maximize our resources and get the best out of, how do you take education into research, and then how does that research translate as a learning health organization into our bedsides as quickly as possible? That's nirvana. So those are some of the key examples that we're building right now. As an organization, becoming more services oriented as we serve the university, but definitely in Iowa as we serve the state as the only academic medical center that's within the state. We've got partners at state borders, but also as that quaternary, tertiary and quaternary for a lot of critical access in rural areas. We've got a huge impact on the state, and IT is that conduit. And we have to have those services mindsets to do that in an effective manner.
Yeah, love it. I mean, everything that you kind of talked us through. I mean, even going back to the intentionality behind the language, thinking about as a customer, as a client, and then, the customer voice, and then relaying the roadmap to the customers. Curious to how or what forums you found have been the most effective in surfacing customer feedback, and then also in allowing you all to communicate the roadmaps to the customers and allow them to understand, that you took what they provided feedback wise, and now you're operationalizing it.
Yeah, great question. Our focus is to how can we embed ourselves in conversations that are already happening. Again, to eliminate the friction of, hey, there's this think tank group happening in our organization. Now they have to come to IT to re-explain. So when I first came in, looking at where are those conversations happening, and we have some great structures in research, education, and in healthcare that we're able to plug our thinkers into. Of course, there are some areas of focus that we want to build out, especially around digital health. When you talk about our digital health early on, as soon as I came in, we wanted to frame what does digital health mean to us,
Right.
from the purest sense. And so there were a couple of groups that we saw that we needed to bring together on digital health care delivery. Think again, televisits, e-consults. How do we maximize that? Patient digital experience. That's another group that we are now just forming. It was happening in pockets. It makes sense for us
Sure.
to come together with our constituents there. And then, and I'm sure we'll get into it, AI, smart operations, advanced analytics. Those are three areas that we saw the need to have specific focus as opposed to embedding. But that has been key. The other key, Tyler, has been where in our internal conversations can we start plugging in other operators to hear as we're talking about where does it make the most sense. And so we're talking about that conduit. So again, we limit the amount of meetings, we maximize the most of time the thinkers are together so we can execute. So
Yeah.
seeing those structures and forming them have been fantastic. Our organization, it was something that's very resonance with me is there's a lot of great things happening here at the University of Iowa, and in the healthcare space. And we're very humble about it nationally. And that's something that our VPMA, she's been here for 2 years, Dr. Denise Jameson talks about a lot is, hey, when you're out there, let's start talking more about what the Hawkeyes
Right.
are doing, how we're serving the state, but how we're doing things nationally. And I only say that because that helps us then plug into other conversations to move that needle forward. But it is about embedding us versus seeking us out.
Right.
When that seeking out happens, I find that to be more of a transactional relationship versus both sides being part of the conversation up front. So embedding is very important for our strategy as we move forward.
Yeah, no, and having been on the delivery side years ago, and also just in a customer serving organization as HDM is, totally understand the importance of meeting the customer where they are, embedding, creating another step. It's like you said, it's that friction point, and it may not bring the same flow of conversation or feedback as you get when you are actually going to the caregivers, the researchers, or the educational component. And good segue. Thanks for bringing up AI before I did. So obviously, that's a big part of innovation in our current landscape. But there are other tools as well. But how do you balance the innovation, whether from AI or other tools, with operational stability?
Yeah, that's a great question. Something that we've designed, and it is, I've seen it in other models too, is we've got this triangle of focus when we talk about what are we doing from a solutioning standpoint. And it all starts first off for us would be efficient and secure operations. You can't build innovation on top of a house of cards. And if you don't have that secure, operational, efficient mindset, that has some metrics to it. So you can definitely manage how you're doing from that standpoint. The more you're efficient there, the more you can spend time on the new things, on the innovations that are coming and the optimizations that are coming. The next tier of our triangle that we are now focusing on is impactful optimizations. A lot of IT shops get can you change this for me? Can you change that for me? And it might be more feel than focus, and us balancing with our organization of really trying to prioritize and be the most impactful with our optimizations. Does a new piece of functionality help one person, but 1,000 lives? Or does it help 100 people, but only covers one life if you're talking about patients' impact? And us
Right.
balancing what that means. So having those measurables there are very key. And then layering on top is intentional innovations. Resources are tight, money is tight. Us understanding where the business is going and finding the intentionality between our innovations, not just having pilots for pilot's sake. I know a lot of organizations take innovations a little different, whether they do it in-house, whether they partner with organizations to make their innovations more about how they've implemented it versus developed it. We're taking a journey on both sides of that fence. Again, when we talk about where we're going as an organization, but how do we do it with intentionality? You can get spun up very easily on try this new thing here, there. The idea of a pilot. Is a pilot meant to be, it's here, we learned, we took it out, and we evolve? Or as other organizations, you see these pilots become one-offs that they end up having to support, and it has no continuity and experience.
Sure.
You mentioned it just a little bit earlier, Tyler. It is about, and for me, IT is about how do we reduce friction?
Right.
How do we make the patient provider the focus of the intimacy and not the technology? Have the technology enable it, whether they're in front of us or whether it's remote, like the conversations we're having today. And so coming back full circle about that intentionality about implementations or innovations, you need some of those guiding principles to drive it of why are we doing it? Are we doing it just for notoriety? Are we doing it to be on a podcast? Or are we really doing it to make impact in patients' lives? And everything has value. It's really balancing those things. And for us, it's showing the organization where are we spending our time, what our mission is from operational standpoint, to then show them maybe where we're not going down a path where we're getting the most impact and how can we bring that together. One of the main initiatives I have going on that I like to move fast, and I'm hoping by early summer we've got a good iteration of some prioritization, some focus on categorization of the work versus us first in, first out with tickets or trying to manage project management and prioritization outside of the organization. How do we get some prioritization focus on the buckets of work that we're doing? Just the buckets I'm talking about with a little bit more specificity, us balancing the right time and the right focus, and then pushing the organization to understand, hey, if you've got that transparency of our prioritization focus, then they'll also know and have a good understanding of when they make turning point decisions in between planning that they know what they're going to impact. And so that's a major focus of us of how do we get that balance. But all of it, Tyler, for me, has to be a focus on that patient-provider relationship and how do we always move the organization forward. A lot of times you might see a lot of work be done just to rework it. New leaders sometimes have that mentality when they come in. I'm going to spend the next 2 years re-eventing ourselves just to create an environment that's comfortable for us to springboard into. These times, you don't have that time to waste, especially as IT turns over, as you know, from innovation. So being that prescriptive, but being having agility and pivot points in there built in is going to be key for that balance of operations and intentional innovations.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change, or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show.
Yeah, and it sounds like, and maybe you sort of said this and my slow brain doesn't pick up on it, but when you're doing that prioritization, it's the mission, it's those three, like education, research, care, like those are kind of the guiding principles behind the categorization or prioritization of the work. How you get your the troops fully aligned and accountable to whatever the principles are. And maybe it's a lot of repetition, but yeah, curious to have some of your techniques to create alignment.
Yeah, and this goes back to our earlier conversation about the role of leadership, especially as leading digital transformation or technology. I find my role to be one of the key points is change management. And it's communication, like you said. I've got internal constituencies of my team, also partnered with campus IT of how we deliver a great experience at the university. How in my role can I translate the whys enough to keep momentum going, to have forward thinking within our department, but then also translating the why upstream of where we are from a technology footprint so people can get ahead of it. So first and foremost for me, change management is all about transparency. So something we're building, actually have our first iteration of it here, is a strategic 3-year rolling roadmap that is really meant to show the organization, 1, that we're listening, 2, help us prioritize, 3, help us internally be directional about those categories I mentioned earlier, And it's something that we're looking at quarterly and being transparent about it. Our goal is when it's in a good state, we're going to start sharing it to our entire department on a regular basis so they can add to it from what they're seeing in the industry with them being closer to the business, and also using that as the conversation point with strategy conversations and operation conversations. So it does, you mentioned it, it is repetition. I find myself all the time going, man, people are probably getting tired of me talking about mission, talking about margin, and where's the balance of both in our strategies? Because you need a balance of both here in healthcare, of mission-driven opportunities and margin-driven opportunities. How do we bridge the gap around understanding of where, you know, the organization tries to make a decision today, but are we ahead of the business enough to know that technology is changing tomorrow? Wait one more day. And so I find that communication is key in my role. Translation is key. Understanding those key resources that are allies. So then you start getting the momentum. You know, I say this to my team all the time. I practice my enthusiasm and conversation with my direct leaders, not only to practice the message to get the momentum going, but to get them speaking it as well. And so then when they're out working with their teams or other people in the organization, and as I'm working with my peers at the senior leadership most level, it's a consistent message. It's a consistent enthusiasm. And so the organization also sees that as a change management of they're aligned, they're all saying the same things. Now there's better partnership, there's better trust. So it's a lot about change management to bridge that gap around rapid change, you know, rapid innovation, and how we can support the organization.
Yeah, and
tying the why to our people too. That's key. You know, I'm learning this. We could go down this tangent too with IT being such a remote based role these days. It really is harder to have our frontline staff really feel the mission on a day in, day out basis. You know, they're not in the four walls anymore. They're kind of farther removed. It feels more like work than mission. So a lot of it too, Tyler, is when we can get together face to face or implementing newer strategies like town halls with more enthusiasm, more inputs, more conversation with our department helps get them closer to the mission, even though they're not physically here. And that ties into our continuity and intentionality as well.
Yeah, no, love that. It makes me think of, we had an episode with Nebraska, another Midwestern university behemoth a couple years ago, and they talked about how they used some like dashboards or images to show like the patient impact of the work they did, and you know that really did drive home the why, because like you said, in this remote world, and we're not within the four walls, much harder sometimes to visualize how, you know, pushing one thing to prod might have a major effect on patient care. And then, you know, obviously there are the bigger opportunities with the, you know, technology innovation. Like what are some of the bigger digital technology opportunities these days that you see that could really improve the patient or provider experience? You know, that maybe you saw at one of the conferences we run into each other, or that you're, you know, super thrilled about Iowa taking on. And maybe if it's super secret, you can cloud it in.
No, I can. A lot of folks are focusing on the same thing. What I'm very proud and honored to be a part of here at University of Iowa Healthcare, they've got a storied tradition on being innovative and having a lot of great tools. What my focus wants to be is more of how do we connect those tools in a seamless experience so our end users focus, clients focus more on what they need to do. I talk about this all the time of how do we allow our technology to help everyone work at the top of their license, whether you are in EVS or whether you are in being a provider or in IT. So when we talk about the new technologies, AI helps bring all of that together. It's helping that create more less friction and more availability for us to be more strategic thinking than stuck in the day-to-day. So it is very exciting and new to see the possibilities of AI. Yes, it can be scary. It can feel different, But once you really start getting a good mantra and focus around, I'm all about guiding principles, those true norths of why you're using it, what you're going to use, that is very key. And we're starting to see the momentum there. We're looking at, and we've implemented some great technologies. I won't go into an endorsement of them, but when you really talk about the ecosystem, we're really looking at what's a platform for AI. Yes, Epic has some of the tools, but what are some other players that are in the market that it's not bolt-ons? It is more of an encompassing experience. So that is very exciting to see. It also, for me, I'm also very proud and honored to be a part of a great enterprise data analytics team here. They're forward thinking of how are we using cloud technologies to bridge that gap with data. And I think with AI, my personal view is it's renewed the focus on data, not just having the data, but it's renewed the focus on clean data, on understanding our data more, because AI, garbage in, garbage out. And really with generative, you really don't want that to be the garbage out when you talk about the data that you have. And so there's a renewed focus on how we align data. So that's been key for us right now in those insights. And then last but not least, one of the biggest parts of excitement for me, and for years it's not a tension conversation, if you will. When we talk with a service line, they go, I got to build a hospital, I got to build a clinic, and we got to invest in bricks and mortar. And my mantra has been, if you have a bricks and mortar plan, you should have a digital health plan, virtual video visits. But now the smart facility technologies where, bare metal or bricks and mortar are going to be key for what we do from a footprint, from a place in the market. How do we use those four walls from a technology standpoint? So sensors in rooms, AI technologies for telenursing, to keep nursing in our workforce. So creating an ecosystem that is truly wrapping our digital arms around the patient, not just when they're at home using video visits, but when they're in the beds or in our clinics. How are they still touching technology? So I'm really excited for the rapid growth of that and how we're, again, tying these technologies into a seamless experience versus them feeling like separate experiences. Another mantra I have is, how does our culture from University of Iowa Healthcare, our care methodology and care values come across in our technologies? And so finding those right ecosystems to do that. So those are the three areas that really excite me: the renewed interest and focus on data and digital insights, layering on with AI, reducing friction, allowing AI to allowing us as humans work at the top of our license, be more at focused energies versus administrative energies, and then the smart facilities and how that is evolving into how we're wrapping our arms around our patients when they're in our bricks and mortar.
Yeah, I mean, love that example, because it's like you can really see how IT is just so much more than IT. Like the workflows of new brick and mortar need to, and it's not just because IT is asserting itself. It's because, if you want to have the most value from sensors in this hospital of the future, you really do need to have a plan that doesn't apply at post, but as it's de novo, it's integrated. So love to hear that, as it it makes me feel closer to the actual patient engagement or provider piece. On the data, just to go a little bit deeper, so it seems like one of the guiding principles you have is AI is here, so we have to have great data. Otherwise, the input is going to create a bad output. And maybe if you can expand a little bit more on the data strategy. I mean, maybe that's all you need is that mindset. But anything more on the data strategy, as you said, as it's come more front and center to relay to our guests, would be super helpful.
Yes, certainly. And I'm, again, honored to be part of a strategy that was already being kicked off by our Chief Data Analytics Officer, Pink Rose Hamilton. She's got an energy around not just about, data sometimes is focused on, more times than not, where is the data, versus let's not worry about where the data is. Let's worry about how do we access it at the right time with the right cleanliness to layer on either advanced analytics from our forefront standpoint, or layering on top of AI, because we can spend more time engaging with the data in a thought process as opposed to it being an outcome of a hypothesis or thinking. And so the strategy has been, how do we align on some digital visualization tools that can maximize cost and spend of these tools, as well as cloud and where our data is stored, to combine the interests of healthcare, education, and research. How can we make sure that, again, it's not so much about moving data around so everyone
Right.
can get access to it, which takes up a lot of enterprise data time. Now it's more about, all right, there is the data. Let's worry more about how do we connect to it where it lives, and then making sure we have good, strong data governance on top of it. I'm in an interesting situation that's very exciting. There is a new CIO on our campus IT front. Brad Rohrer came from the Miami market, and he and I have been recently talking about, and this is, I think, progressive thinking on both of our parts. How do we get the entire university to think data governance as a whole, and
Sure.
bringing healthcare and the university together at the highest levels of data governance and management? Students are patients. Patients are students. Data is data. We use our data in the education arm as well as in the healthcare arm. How can we even have that layer bring on a good definition of data so it cascades down to the rest of the organization? So now you start really talking about maximizing the resources in our environment, not just two separate, here's the healthcare data, here's university data. Now, again, it is about not where it lives, but how do we access it? That, I think, is the strategy of the future. I think because I'm energized by it, it's not a strategy that I necessarily divulged into. I got to
Yeah.
give all the credit that Pink has and her team has put together and that I
Sure.
walked into. But it's going to be an amazing journey. As I talk to other colleagues and peers, we seem to be ahead of the curve in the thinking. Organizations are still trying to manage where all their data lives, as opposed to how do you remove that barrier,
Right.
especially with strategic partners from a cloud perspective.
And then while we're talking about ahead of the curve, kind of brings up a question that's come up, I think, more recently is, we were in this, it used to be a struggle between like the enterprise, maybe if we just look at like the EHR tools, it was like enterprise versus best of breed. And then like innovation, do you buy, do you build? With a lot of these AI tools, it's becoming very possible that you could build, a software platform overnight, which is great in a lot of ways, but that's a rapid change. And wondering how you think about, if a services firm, not HCM, but say a services firm comes to you and says, well, instead of keeping this platform, why don't you just code it custom, and then you can, you talked about margin for a second, you can get rid of the cost per seat. You might have to put an upfront cost to create the software platform, but then you own the software platform, and then it's the cost per seat cost just kind of disappears outside of keeping it up and running. Like, that's just an example, but how do you think about these kind of rapid changes now that are coming available to you?
Yeah, well, you know what, Tyler, it's had to evolve my thinking. And really, even very recently, my thinking has been changing around this. I've been historically started a small organization where we didn't have the resources nor the money to create our own, and the long-term investment that it takes, not just on talent, but on maintenance, on upkeep, and what that means to be interoperable and design that. And so I was very, very best of suite focused to maximize our environment. And now as I've come here to Iowa and having more of a footprint where there is some development, I again was early on of, I really don't want to get into developing our own because of the total cost of ownership.
Sure.
But again, it's been a great relationship that I'm forming with the new CIO. And he was talking to me about some of the services we provide, especially around ERP, of really changing that focus and saying, hey, AI can now be used as a leverage partner with our developers, not just to develop the tool, but to make the maintenance more efficient. I was even talking with a dear friend and colleague who is in web development in a different industry. And he was talking the same way and challenging my thinking of going, listen, there might be value now of thinking about maybe not creating, your own EMR, because they still want to avoid
Right.
the interoperability challenge of,
Yeah.
okay, now, if the industry went that route, and yes, we've lowered our costs, but now we've can't talk to each other via the network of networks. But what are those areas like ERP? We've got an interesting ecosystem here where we've developed a layer of interface for our end users and our leaders, so they don't necessarily touch the ERP. They've got a development layer.
Right.
Well, the concern has always been, can you keep up with our demands to create that interface working? And this is where that thinking came was, well, yes, with AI, we can move quicker with our developers, as opposed to,
Sure.
you know what, it's just easiest to find a vendor, follow
Right.
their roadmap. So my thinking is now changing. And so one of our core deliverables that we have as a leadership team in our HCIS department, we're setting up department goals. And one of them for this next fiscal year is training everyone on AI. One, I want to get them using it. Everyone needs to, I say to everyone, use it. Use it in your personal life. Get a little educated. Use it, the tool, to educate yourself. But we've
Right.
got to get people in the mindset of thinking of how to use it so they're not afraid of it. So they're not like, oh, now it's forced upon me, I'm losing my job.
Right.
I'm sure you've heard from other folks on this, and in your passings, people go, right now, AI is not going to replace jobs. It's going to replace the jobs of those folks who aren't using AI. And those are the
Right.
folks that are going to be replaced. So getting our folks into that mentality of how do we use this tool to allow us to work at our top of our license. And I think
Right.
I know it's changing my thought process of now, oh, if we have good development standards using AI, it can be a differentiator, like you said, to cut out overhead. There might be some tools, and I think this is going to be an industry disruptor, where we do decide to create our own, where maybe the tool isn't specific to interoperability. It might be another, need an EVS or something in facilities. Maybe the non-traditional clinical areas, but in business areas where it makes more sense for us to develop than to find a tool, especially when you're talking about the different ecosystems. Like I said, we're a academic medical center with a big partnership with the university. There aren't a lot of vendors that bridge that gap.
Right.
So we're going to need to use development to make an ecosystem that feels that way. So, I go back to your early point. You said it best. It is something that is going to change the thinking, and people just got to be open to, it's not one way and you go that way. It's being open to having an evaluation of what's the right way at the right time, being open to development and now procurement. And then in procurement, maybe there is a reason to do best of breed versus best of suite. We'll always be a best of suite organization when we're procuring,
Sure.
but the development is now entering more in the conversation, especially when you talk about research and education. That's a very interesting area. I have not come from that arm. So
Sure.
it's been fun to get to know that and seeing where innovations and development and AI can help push the needle in those areas as well.
Well, whenever a guest says that I said something insightful, I know it's time for me to end the podcast, because that's a 1 in a million comment. So, but I will close this off. But we determine you're in year one of maybe 30, but although with longer lifespans, maybe it's a 50-year, 60-year run.
Yeah.
But if we shorten it a little bit and where you're looking ahead, 5 to 10 years in the future, maybe you need to even shorten it because everything's changing so quickly. Like, what are you most excited about the future of healthcare technology and the role digital innovation will play in improving care delivery?
It's the quadruple aim has been something we've all been striving for, and and one of those is experiences from our patients and our providers. And I think what I'm most excited for is the day that's coming where the technology is in the background. It doesn't have to be a key focus because of how it's inputted or not. We talked earlier about my Epic experiences. I remember early on, not just being at Epic, but implementing how we were teaching providers how to engage with the patient and the computer in the room. I'm most excited for the days where it's just a seamless experience for patients, where it is just part of their care and it's trusted. Technologies like digital wayfinding. We're a big organization. As you mentioned, I was in the Big Ten at Michigan Medicine, another large organization. And as not only a provider in that organization, but as a patient, my first concern is, hey, I'm going to the hospital. Where am I going to park? How do I get around? And how do we give those technologies that are just seamless for people to use of all generations, not just focusing on one, so they know the technologies are helping them really focus on what's most important, them engaging in their healthcare with us. And so I'm really excited in the next 3 to 5 years of how AI is going to help us do that, bridge that gap, that intimacy, how data with AI layered on top is going to allow our providers to get to more insights real time and help them make interactive decisions, using it as a sounding board, as a trusted sounding board. And then how the four walls will start to contribute to health and well-being, not just in the hospital. Would love to see the federal government really, really double down and just make in-home care really something that we can get ahead of from a reimbursement standpoint, from a care standpoint, because we're better to have a relationship with a provider, but in the comfort and safety and warmth of your own home and family. So the more that we can get our digital technologies to do that in the background and not be wedges to those experiences, that's what I'm most excited for. And I know my team is excited to carry that vision forward within Iowa and be examples nationally and internationally for what we're doing here at Iowa.
Awesome, Josh. Well, thanks so much for joining us today. Thrilled that maybe this podcast could help a little bit with being the example that Iowa is setting for the rest of the country and the rest of the world. And we are definitely rooting for you all as you accomplish this vision.
Thank you, Tyler. Appreciate the opportunity, and go Hawks.
There you go.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on YouTube, Spotify, and Apple Podcasts. And don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.